here. Okay, so chapter 12, patient teaching, right? This chapter actually talk about how we have to educate our patient if any patient need, right? Because when we talk to patient, um, and some of the patient need to know, like as an example, a patient going to discharge after the diabetic treatment, and if patient need to use the insulin, they should know how to use the insulin, how they collect, how to preserve the insulin at the refrigerator, right? And how they rubbing it, right? And never shaking like this. And this is called the patient teaching, right? This PowerPoint talk about this very short. This chapter only 19 pages. The terminology related to the patient teaching. One is the way of teaching here: auditory learning, health promotion, then kinetic learning, reinforce, visual learning, and wellness strategies. So auditory learning means if you talk or if they hearing something only, right? Learning by hearing or listening. Suppose you talking, your patient just listen, or there's some audio, they can listen it and they learning. It's auditory. Second one, like visual. You patient watch some videos, right? And then they can learn it. So learning by watching something, observation, or reading, or watching like videos or short film, and they learn. It's called the visual. Some of the tools we use for the patient teaching is called audio visual. Mean same time they watching and reading, audio visual, right? Even same time they are hearing as well. And some of the patient when they um, learn something from you, and after that you tell them, can you do it again, or demonstrate it again, or remodeling again? If they do not understand, we have to re-educate them, right? Re-teaching them, and this is called reinforce, or reinforce, and keep it mind always the RN do it. RN educate the patient, RN teaching the patient. But if a patient need the reinforce, means re-education, the LPN can do this. So board asks this question and we do wrong here. RN always educate the patient, RN always teaching the patient, okay? But when patient need the re-educate but reinforce, LPN can do this, right? Because LPN always work under RN, or under RN supervision, they can do this. Yeah. And whatever audio visual or visual teaching process or re-education, all of the target, right, to improve the health. So the action related to way of becoming or staying healthy. So whatever the teaching, our main purpose or main target goal is the health promotion. Health promotion. Another one is called kinetic teaching. What it is? Kinetic teaching means teaching by touch or doing. So some of the parts people has a hypnotizing capacity. So if they touch, the patient feel good, right? Sometimes it's spiritual or religious. And also, last is called wellness strategies, action designed to promote the health practice basically. And go next here, the learning style. There are three main category of learning style. One is called visual learning, auditory learning, and kinetic learning. So already we talk about this, just a little bit recap. Visual learning, basically observing or reading something or watching videos, right? And we learn, or patient learn. Auditory, so you teach the patient and patient is hearing or listening, right? Auditory. And also kinetic, I said that when touching, right? Or you do something like relaxation therapies, as an example. Or some patient, patient has a hypnotizing capacity, they touch and patient feel good, or patient learn something. Suppose another way, if a patient need the range of motion exercise and you touch them and you show them how to do the most range of motion X in the lower extremity, right? They learn it and they do it at home. So this is kinetic learning as well. Kinetic means movement. So go next here. Here saying that addressing the patient learning style, people learn in seven style. Most prefer one style is called address each style of learning, like verbal, written, or videos. Also use the return demonstration. So this is actually the patient learning style. Learn every style. Most preferred one style is called address is the style of learning, maybe verbal, talking, or auditory, then writing or videos, right? Observing. Also, we what they learn, we tell them, can you do it in front of us? Means modeling, right? And this is called demonstration. If they do wrong, you can reinforce them. Hmm? And actually, this is the best way of learning. And then factor, what are the factors affecting the learning? First of all, environment is most important factor of learning. Imagine you and me are interact over the Zoom right now. If you are driving the car and I'm walking in the or jogging in the road, and we are also talking, is it the same thing what we do right now? You are sitting in your room and I am sitting in a table and chair, and we are interacting. This is more better, effective way of learning, right? And also the comfortness is very important. If I feel too much shy with you, if I'm not friendly talk with you, okay, or if you do not feel friendly to ask me question, okay, if you feel hesitant, how we exchange our views, we learn from each other. So comfortness is most important zone of the exchanging the knowledge or exchanging the information. Also the readingness, most important factor of learning. Everybody know that if we do not know how to read, how we will learn. And also the language barrier. So if you go in the health hospital or health services, there are so many languages right now interpreted they use, because the language is important barrier if you do not talk in the same language, right? And also this makes sense another important factor of the learning, the memories, learning the new thing. So if some of the culture do not allow to eye contact, if they do, if they avoid eye to eye contact, right, actually we're missing so many good information. Sometimes we do not talk, but I can talk so many things. I can positive, reflect positiveness or negative, not deny. Okay, so the sense also very important tools for the learning. And then go for here, guideline for arranging for an interpreter, right? So keep in mind, you and your patient, uh, think the scenario, your patient and you do not talk in the same language, but patient sibling or patient children can speak your language, but keep in mind they are not allowed to work as an interpreter. Even if you have a friend in hospital setting, they can speak the same language. Also, your friend or other co-worker not allowed as interpreter. So, who is the person do this? The certified interpreter only, and also the hospital person. Hospital interpreter only allowed to deal with you and your patient, right? Arrange for an interpreter who speaks the patient primary language. Also use the professional interpreter. Also arrange for an interpreter who has some understanding of medical terminology. Also, try to avoid using the young children as the interpreter, right? Very important. So here, and also go next, the purpose of patient teaching. The purpose of patient teaching here. So purpose of instruct the patient on health promotion and wellness strategies, and also explain the disease process, treatment, and care. Here the purpose of patient teaching. What are the purpose? Purpose is explain the disease process. First of all, explain the disease, diagnose the disease, treatment option of the disease, right? What are the different kind of uh, care you provide, services, and finally the promoting the health, basic and real or most important purpose of the teaching. And here some of the example of patient teaching. One of health promotion, wellness strategies, and disease process. So example of patient teaching. Whatever we teach or do, our main target, improve the health. Now, like we educate the patient every day. You should do the exercise. So why they should do exercise? Just promoting the health, right? And also promoting. Susan,
Yes.
is there any music in your room?
No, that's the clock. It goes and the hour, it will stop.
Okay, no problem. I'm so sorry then. Yeah,
Mhm.
okay, so basically I said the our main target to the improve the health. Suppose you told your patient every day you should take a good food, right, or healthy food. So when patient take good food or healthy food, this is actually promoting their health. Also the healthy lifestyle, right? Healthy lifestyle, or or less sedentary lifestyle actually protect your heart, and also reduce the cholesterol. Both of these promote the health. So our major purpose of teaching, promoting the health, improve the health. And willingness strategies, like you tell your patient, don't go for the smoking, you have to stop the smoking because smoking is an important cause of lung cancer. So here's the willingness. And also if a patient is obese, obesity is a major cause of disease. Obesity actually eat your heart, leak your kidney, right? So it is not good. So obesity is an important factor, and when reduce the obesity or weight, it is willingness strategies. And finally, disease process, the teaching about the insulin or teaching about hypertension, right? So I said, if a patient has diabetic, you teach how to use the insulin, and if patient use or get the proper insulin, they progress the diabetic. Same thing, if patient do not know the proper doses of medication for hypertension, the hypertension will not be controlled and hypertension lead to damage other organ. So basically when you teach them, actually the disease process should be stopped and patient feel good. And go for the next here. So some teachable moment, So patient asks about the illness of treatment, the nurse seeing an incorrect procedure and also give the correct information. The nurse use the point out of correction of cause and effect of the patient. So first of all, patient asks about the illness and treatment. So definitely we ask the history and then we go for the diagnosis, and patient asks what are their diagnosis and what or illness and what are the different kind of treatment option, right? So also nurse see the incorrect procedure if any and give the correct information, right? Suppose a patient has a wrong idea or information about the disease, we have to find it out and then explain to your patient, right? So this is also the important factor for teaching. And some example of teachable moment. So what is this? First of all, some example. Suppose we are teaching them the bathing or personal care, right? Personal care. So some of the person, especially the psychiatric patient, they do not maintain their hygiene. But if you tell or if you teach them how they should do, this is actually the personal care. Also, we said if obese person you have to improve their lifestyle, if they reduce their body weight is good. So daily body weight measurement, one of the teachable moment. And also ambulation. Some of the patient, if they need ambulating, so ambulation. Also the life food or diet, important component. So if a patient is, example, paralyzed, if you teach timing of bowel elimination or bladder elimination, it is actually help them to fall or any kind of accident in if they hold their bladder, okay, and immediately they want to go to the toilet and chance of falling. So you teach them every toilet habit, or treatment of different disease, and also medication, how they should take the correct doses, correct route, and also the timing of the dose. So all of this is most important factor of patient education. And now go for developing a teaching plan based on nursing process. So keep in mind, when a patient to come to you, you follow some 5 rules and regulation, right? But here the 5 rules and regulation about or regarding the teaching process. Even you and me sitting here and we are interacting through the Zoom, right? You talk, I'm talking, we are exchanging or sharing some ideas about the NCLEX board exam. So also we can apply the 5 stages of care, like assessment, then diagnosis. Like I'm talking to you, then I can understand this student is weak in pharmacology. This is the assessment. This student is very good in other subject except pharmacology. Then I said, okay, weakness in pharmacology. After that, what should I do? Better to give the focus on pharmacology. Means this is the interaction, right? And finally, when you do good in pharmacology and you get the license, is the outcome. So here the assessment first, identifying the patient learning need, assess the patient readiness of learning. Suppose when you teach the patient about something or demonstrate it and patient do not know how to do this, means you identifying the lackings of knowledge. When you identify the lackings of knowledge, you can correct it or you can teach according to the need. This is actually assessment. You have to talk and find out the lackings of knowledge. And finally, nursing diagnosis. Diagnosis, when you go, an assessment means deficiency, maybe of deficiency of knowledge, right? Or patient do not know how to read sometime, and or you can tell your patient you have to read and increase your knowledge about the disease, right? And this can help you to better management of the disease here. And then go for planning. So decide how to teach about the topic. So I said, if you are weak in the pharmacology, then I thought, okay, what I can do, it is better I can give some extra note, I give them some extra videos. This is actually planning, right? So describe how to teach, or also implementation, presents the information in the teaching plan. So also what we have to do, implementation means I am going to give a small talk about this, I give some practice question, you have to sit for the quiz. All of this actually implementation to improve the system. So presents the information of teaching plan. So same thing we can do for the patient who is need to teach. Finally, evaluation. Evaluation we can find out by demonstrating or remodeling, or we can tell them, can you show what I talk or what I did in front of you? Determine if the patient has learning information accurately or not. And finally, whatever did with the patient, we have to keep documentation, right? It is the most important, keep the record for the patient. And here some resources for patient teaching handout. First of all, associate with the associate and foundation, health department, and patient education website. So some resources here. Support a patient is diagnosed by Barger disease or Huntington chorea, okay, or Alzheimer disease or Parkinson. So I teach the patient, okay, you diagnose with this disease, I'm teaching this one. Same time, I give you the contact number of social worker. Social worker help you to find out the community, the people who are Alzheimer disease. So you have to go meet and learn how to deal with their life, improve their life. So you tell them associate or foundation to help them, your patient. And also some health department, there's a good website and good information, phone number, they can contact with them and also increase their knowledge about the disease, right? And other things is patient education website. There are so many websites, but we have to find out some good materials, good website that is really helpful for my patient, nothing fake. And here the teaching, okay, now we're just going to teaching for the special need like the children or elderly patient. So definitely children depth of knowledge or broadness of education is not like the adult person or elderly person who forgetfulness is most common. They are capable with their catching capabilities not same like adult healthy people. So for teaching for the children, use is appropriate information. We have to use the information which is best for them. Also use a doll or teddy bear for demonstrate, not remodeling here. Allow the child to perform the treatment on doll. So suppose you are going to put the insulin because some of the diabetes is also common the children, juvenile diabetes, right? So you tell how what I did. Can you show me in the doll or teddy bear? They do this, right? And they actually learn. Always tell the truth about whether the treatment will is uncomfortable or what, right? Always we have to be truthful to the patient, especially the children, okay? So they get influence. And take the advantage of opportunities to speak at the school and daycare center. If possible, also we have to take this advantage or opportunities. And now the teaching the elder patient, right? So teaching the elder patient here. So we have the caretaker or family present. So when we talk to the elder, we did keep in mind nobody can abuse the elderly patient, right? So it is better if the caretaker or family member, anyone should be present there. And always, when you teach for the elderly patient, take enough time. As an example, if patient has a Alzheimer disease, the forgetfulness is most common. What you are telling you, they forget. So better take enough time. You have to redo again, re-educate them, then give them time to think, reorganization, and then they tell and you have to listener, good listener, right? So be alert to the cure that patient does not understand, and also the patient, and use the plenty of repetition all. Now here they said evaluation the patient teaching. After all of this, we have to go for evaluate the patient. Evaluating have the patient restrained what is we teach the patient or we taught the patient. Ask the question to determine the patient understanding. We have to ask some leading question to find out my patient understand it. When we go through understand, we try to print something in their mind, right? We try to convey some message to them. When we ask, we can get the level of understanding, right? If they do not understand, we redo it, we reinforce it. Ask the patient to give a return demonstrating, so we can easily find it out. They get or does not get. And then some guideline for searching from the internet. So always when patient go home or after the discharge, we tell them some important good resources, right? So patient can read it or self-education system, but keep in mind what are the website or source we are giving, it should be authentic, right? Nothing fake, nothing false, nothing I mean lose some money like this. So guideline for searching the internet, explain the preferred site for healthcare information. Tell the patient to avoid the reading blog because there's so many propaganda in between. So some are fake, not true. So it is not to tell because they actually they make them panic, anxiety and stress about the disease. Encourage the patient to use the familiar site that contain most accurate information, right? So this is the way we have to find out the kite information from search the internet. And some guideline also explain the author credentiality. They have a real education. Do they have a license or not? Right? Education background is most important. Explain the commercial website. They sometimes they try to selling the product. This is not good. You are not reliable upon them. Also give the alternative to the internet. So basically when we give them or help this way, this is the real way we teach our patient, right? this is the PowerPoint here, how we have to educate the patient, right?